So our study really wanted to try to understand differences in Alzheimer's disease from the perspective of the actual brain tissue. So these patients have donated their brains for us to be able to investigate under the microscope. But even though we know that there are differences and health disparities, we don't actually have a really good understanding of changes in the brain under the microscope. And so by examining ethnoracial differences, specifically meaning Hispanic Americans, African Americans, or non-Hispanic white Americans, we can hopefully broaden our understanding of the biology of Alzheimer's disease. Our major findings were actually striking differences in their survival with the disease. The Hispanic Americans were identified to live with the disease for 12 years in comparison to the non-Hispanic white Americans who were found to live with the disease for 9 years and 8 years in our African American group. This is especially impressive given that the Hispanic Americans were identified to start the disease younger in life. So ultimately, our findings emphasize the importance of looking when did a person start with the disease? When was the first symptoms noted? That might actually help us to understand how long the person might live with the disease based on their self-identified ethnoracial status. How long did they actually live with the disease? We call this survival or disease duration, but the length that you live with the disease, does that mean that you're going to have more brain changes? Or maybe you have protective factors that we don't know about and you have less brain changes. These are really exciting questions that we get to answer with this group of people. So our study doesn't translate to that if you're Hispanic American, you're going to get Alzheimer's disease. If anything, one of the most interesting aspects is that there's protective factors that we currently don't understand and that we're really excited to investigate why there are individuals who are able to withstand this devastating disease so much longer.